Hi, my name is Randy Kwon. I am a first-year dental student at Roseman University, and today I will be presenting on the impact of probiotics on oral health. Before I continue, there were no conflicts of interest in this study. The word probiotic was a term that was first used in 1965, and it was used to describe substances that were secreted by one organism which stimulate the growth of another. Probiotics are live organisms that can be very beneficial to an individual's health when administered in adequate amounts. Probiotics consist of many different specific bacteria. They also can be administered in many different forms. As you can see in this image above, there are different types of probiotics, and these four can branch off into different subset of probiotic bacteria. The study of probiotics is still ongoing, and we are still learning on the exact function of probiotics in the mouth. Certain studies suggest that probiotic microorganisms are often utilized to enhance gut health, which has been proven to result in several health benefits. Some of those health benefits are listed right here: improved digestion, reduction in allergies, reduced insulin resistance, antioxidation effects, anti-obesity effects, improved lipid metabolism, and stimulation of immune system. When it comes to oral health, probiotics have been linked to the reduction of cariogenic pathogens and dental plaque. They have been for the prevention and treatment of periodontal disease, while they are known to assist in the reduction of halitosis. The objective of this study is to summarize the existing evidence regarding the impact of probiotics on different aspects of oral health. For our methods, the systemic review was conducted following the PRISMA guidelines. 6 databases were used with customized search strategies. We then had an initial screening that was done by 2 independent reviewers. We had an inclusion and exclusion criteria applied to determine which articles were fit for our research. Data extraction was then done by 2 independent reviewers using customized data extraction tools, and we are still pending the critical qualitative appraisal of the studies. Here, we have the inclusion and exclusion criteria that we used to find the articles that we wanted in our research. As you can see, some of our exclusions included animals, patients with syndromic and/or genetic disorders, systemic reviews, ongoing studies, and so on. And some of our inclusions included human subjects, clinical studies including the administration of probiotic microorganisms, studies that focus on the association of probiotics and oral health, and so on. Here is the PRISMA flow diagram that showcases the number of articles we started with to the number of articles we ended up including in our study. As you can see, we started with 2,487 articles, and of those articles, 1,876 were removed due to being a duplicate, which left us with 611 articles. And then after going through screenings and excluding articles that didn't fit our criteria, we were left with 88 articles that we could include in our studies. The study design from those 88 articles showed that 94% of those were randomized clinical trials and 6% were prospective clinical trials. There are many types of probiotics, and not all probiotics are equally effective for all disease prevention or treatment indications. Looking at this table, we can see that Lactobacillus reuteri was the most common probiotic used in these studies, with 22 articles using that probiotic. Now, there are more probiotics than what is listed here, but this table includes the ones that were most used. Here we have the different vehicles of administration of probiotics. The most common one was lozenges, with 28 articles, the second being tablets, and the third being milk powder. As mentioned earlier, probiotics can have many different effects on the human body, and that is no different with oral health. As you can see from this table, we measured 6 categories to see how effective probiotics are. We measured plaque, gingival index, bleeding on probing, reduction in S mutans, caries, and halitosis. The blue represents a positive impact, while the orange represents no impact. The 2 categories that I want to focus on right now with the biggest difference is bleeding on probing and reduction in S mutans. Bleeding on probing, which assesses signs of inflammation that is associated with several periodontal diseases, has shown to improve when probiotics were consumed. And the reduction of S mutans, which are bacteria that resides primarily in biofilms that form on the 2 surfaces, has also shown significant improvement with the consumption of probiotics. Caries and halitosis have also shown great improvement, while plaque buildup and gingival index were positive but also had some no impacts. From the information that we have gathered so far, we can assume that probiotics have an overall positive impact on periodontal disease, caries, and halitosis. And from the included articles that we have, there was no negative effects that have been reported so far. Now to conclude, probiotics could be promising adjuncts to the maintenance of good oral health and prevention of disease in the oral cavity. Further studies are required to establish clinical treatment protocols on their effective use. And lastly, I would like to thank Roseman University College of Dental Medicine Clinical Outcomes Research and Education for the support of this study. That is the end of my presentation, and thank you very much for your time.